Today, let's delve into the subtle, often overlooked, early warning signs your body sends to alert you to the possibility of colon cancer. While this disease frequently affects individuals over 60, younger people are not immune. One early indicator, a subtle but significant change, is a persistent alteration in bowel habits. This can manifest as difficulty passing stool, with the stool itself becoming hard, dry, and possibly cracked, sometimes even tinged with bright red blood, disrupting the normal rhythm of daily life. Experiencing increased frequency of bowel movements, passing small, pellet-like stools with difficulty, perhaps even accompanied by bright red blood, demands immediate attention. This is your body's quiet call for help, urging you to seek professional medical advice. Don't delay. Schedule an appointment with your doctor to discuss these concerning symptoms. Blood in your stool is another crucial warning sign, a stark red flag that warrants immediate investigation. The presence of blood in your stool, or even in your urine, is a serious symptom requiring immediate medical attention. It's a silent cry for help from your body. Fortunately, early detection of colon cancer significantly increases the likelihood of successful treatment and survival. Compared to other aggressive cancers, early detection often makes colon cancer more manageable. Early diagnosis means a dramatically higher chance of survival, with survival rates potentially reaching a remarkable 95%. However, it's important to remember that blood in the stool isn't exclusively indicative of colon cancer. It can also be a symptom of various other conditions, including hemorrhoids, chronic colon ulcers, ulcerative colitis, a simple minor injury within the intestinal tract, a localized infection in the large intestine, or even an undetected stomach ulcer. Certain medications, such as ciprofloxacin, iron supplements, or even lactose-containing products, can also lead to blood in the stool. Diarrhea, characterized by a sudden increase in bowel movements, is another alarming symptom. This is defined as more than 3 bowel movements within a 24-hour period, resulting in loose, unformed stools. However, the causes of diarrhea are remarkably varied, ranging from lactose intolerance, a common digestive issue affecting those who cannot process milk sugar, to irritable bowel syndrome, IBS, or chronic intestinal inflammations. The National Cancer Institute notes that many cases of diarrhea are simply caused by infection or bacterial contamination. Conversely, constipation, a marked decrease in bowel movements, represents another significant warning sign. The colon, or large intestine, is the body's diligent waste processing system, responsible for eliminating waste products and absorbing water and essential nutrients from digested food. When this process becomes inefficient, the body absorbs excessive water, resulting in hard, pellet-like stools, leading to constipation, often accompanied by significant discomfort and distress. Although not immediately life-threatening in itself, it's important to recognize constipation as one of the earliest subtle signs of potential colon cancer. Research consistently indicates that approximately 80% of individuals diagnosed with colon cancer have experienced persistent bouts of constipation before diagnosis. The causes of constipation are diverse, ranging from medication side effects to a sedentary lifestyle. Distinguishing between everyday constipation and constipation related to colon cancer can be challenging. However, if you experience constipation lasting more than a day, especially when accompanied by rectal bleeding and severe abdominal cramps, immediate medical attention is crucial. Bloating, abdominal distension, and unexplained persistent dull aches represent a fifth key symptom. The development of colon cancer can be influenced by both hereditary factors and lifestyle choices, including diet and exercise habits. A sedentary lifestyle, coupled with a poor diet, can increase the risk of colon cancer by as much as 30%. The presence of a family history of colon cancer significantly elevates the risk, increasing it by 10 to 15%. Other risk factors, such as an unhealthy diet, smoking, obesity, and excessive alcohol consumption, further increase the risk by an additional 5 to 10%. Bloating and abdominal distension are common complaints in the early stages of colon cancer, though these symptoms can also indicate other issues, such as irregular eating patterns or adverse medication reactions. If you frequently experience bloating and distension after meals, experimenting with smaller, more frequent meals might help alleviate these symptoms and improve your overall blood sugar control. Persistent fatigue, a pervasive feeling of tiredness and exhaustion, is another notable warning sign. While fatigue is often attributed to lack of sleep, persistent tiredness, despite sufficient rest, may indicate a more serious underlying medical condition, including colon cancer. The colon serves as a crucial gatekeeper, eliminating waste from the body. When this process is hampered or obstructed, toxins accumulate within the body, primarily affecting the digestive system. Prolonged accumulation of toxins can contribute to the development of malignant tumors within the colon wall. If you consistently experience fatigue, accompanied by other symptoms, prompt medical evaluation is essential, as the severity and urgency depend heavily on the location and stage of any potential tumor. Unexplained weight loss, a significant decrease in body weight without any deliberate effort to lose weight, is another early warning signal. This can manifest as a noticeable drop of 10 to 15 pounds, approximately 4.5 to 6.8 kilograms, over a period of several months. While weight loss can also be a symptom of several other gastrointestinal disorders, the aging process, or various other health conditions, it warrants attention. If you experience such weight loss, it's vital to consult a physician to help rule out the possibility of colon cancer. A persistent feeling of fullness, even after consuming only a small amount of food, is yet another symptom to monitor carefully. This feeling of satiety can interfere with maintaining a healthy diet. Maintaining a healthy diet and engaging in regular exercise are critical for overall well-being and help minimize the risk of developing colon cancer. However, when this persistent feeling of fullness occurs, your body is signaling potential issues within your digestive system. As previously mentioned, colon cancer can cause diarrhea, constipation, and bloating, which can significantly impact your ability to eat normally. In conclusion, the subtle signals your body sends should never be ignored. Pay close attention to these changes and prioritize your health. Early detection and intervention are crucial for successful treatment and a positive outcome. We hope this information has been helpful in increasing your awareness of the potential early warning signs of colon cancer.